Well, let's get more analysis now on what we know about COVID-19 so far. And we can speak to Professor Jean-Christophe Goffard, who's a specialist in infectious diseases and head of internal medicine at the Erasme University of Brussels. Thank you very much indeed for speaking to us. We've been looking at a couple of high-profile cases of COVID-19. There's, for example, the British Prime Minister Boris Johnson. There's that of Tom Hanks. There's quite a lot of high-profile cases. And what's striking is that every case is different. So why is it that COVID-19 affects different people in such vastly different ways?
So it's extremely difficult to tell you exactly why are people getting really bad or sometimes recover extremely rapidly. It's probably linked to many factors, such as genetic factors that may provide an immune response that can be either really adapted to the infection and they can get rid of the virus, or an immune reaction that can be really overwhelm the organism and induce injury to different organs. That's a real problem. We don't know what factors makes for the same virus such a different response in the immune systems, and so the recovery can be really fast or really bad.
Professor, what do you make of the theory that it depends on the viral load to which you're exposed to? And for our viewers, that means basically if you're exposed to a small quantity of COVID-19, a couple of droplets, for example, you won't get the virus quite as badly as someone that's exposed to a larger quantity of the virus. Does that make any sense to you? Does that ring true?
No, I don't really think it makes sense. Why do I think that? It's because many patients that are degrading themselves are degrading their health around 10 days after the infection, 8 to 10 days after the detection of the infection. So it means that you already have a high viral replications, which is not linked to the initial inoculum you have. It's not only linked to the virus itself, it's also linked to the immune response. So really, I don't think it is linked to the virus itself. But maybe it may be linked to the viral entry point. It means that you can have receptors for the entry of the virus that may be expressed at a low level in some patients or at a high level in others, and make the virus to be more prone to infect many cells instead of a few cells.
As time goes by, we're all learning more about COVID-19, and certainly the medical profession is as well. And I imagine you're comparing notes with other doctors around the world. What are you seeing with regards to positive signs concerning the treatment of this virus? What seems to be really working at the moment?
It's really difficult because, of course, we feel as a doctor very, very unarmed against the virus. We don't have really effective weapons, and we feel unpowerful to treat the patient. So we are trying hard to find some things, but sometimes we are putting our hopes on old medications because they are not really toxic, like hydroxychloroquine, for example, but we don't have any proof that those treatments are effective to cure the patients. We're using it because it has shown to decrease the viral load in cell culture, so I mean in vitro, and on this way we hope that it's going to work for the patient. But instead, that's not a good way of doing medicine. We need to have trials and to make experiments and see if the patients have a better evolution if they are receiving hydroxychloroquine or Calitra or whatever treatment, because you have more than 60 different treatments that may be effective on just physiological view, but are not demonstrated to be effective in the patient. So really, we need to have trials and to compare two groups, one treated and the other not treated, to see if we are doing no harm to the patient.
Okay, well, we're going to have to leave it there. I know you're very busy in any case on this particular issue. Thank you so much for sparing us the time. Professor Jean-Christophe Goffard, thank you for speaking to France 24.